Hello, my name's David. I'm the OET teacher at MLC, that's Melbourne Language Centre. So Melbourne Language Centre has been running OET now for a really long time, I think upwards of 10 years. OET is something that's become very popular lately, but MLC's been with OET for quite a while now, and for this reason we have a lot of materials. Quite a lot actually, probably more than any other school in Victoria. I've been teaching OET for 7 years now. During this time as well, I did a master's degree at Deakin Uni, which had a focus on OET. During that time I studied how the test worked and things like that as well. So I'm going to go through today with you several things about OET. Firstly, I'm going to go through what OET is, how it's different to IELTS, and also what passing the OET will do for you. So I think some of you should already know what OET is. It's an occupational English test. It's for medical people. This would be nurses, doctors, dentists, physiotherapists, and several other professions as well. And students take this test to show their English ability in this medical area. Now, a lot of students require this to work in Australia in their profession. However, IELTS is a test which is offered as well. IELTS is offered for several different things, for entrance into university and everything. OET is unique to the medical profession. Now, the OET was actually created in Australia by Melbourne University, and it was created because they believed that IELTS wasn't really suitable for medical people. So that's why the OET has been created. So I'll discuss with you how it's a bit different. So listening and reading tests. So listening and reading tests for IELTS is on many different topics. So I could go and do a reading test, and it could be on geography, it could be on science, history, mathematics, engineering, many things. Reading and listening, many different topics. Now for OET, it's always on medical topics. Now there's two major benefits for this. First of all, if it's medical topics, you're probably going to know more about it, and that's going to help you get a better score. But also, a lot of people, when they want to take a test, they want to study for it. So if I was going to go into an IELTS preparation class, I'm going to be in that class and I'm going to be reading about ancient Greek history, then about geography, then about science, about fashion, anything. So in that class, my English will improve, but also I'm going to learn a lot of knowledge that might help you in like a game show or a quiz or something like that, but it's not going to help you much in your profession. However, for OET, if you go to an OET preparation course, you're going to be reading and listening to topics about different drugs, different diseases, types of treatment, and so you're going to improve your English, but you're also going to boost your knowledge on medical topics. A lot of our materials are actually sourced from different medical journals and different sites that universities actually get their materials from. So while you're in the preparation class, your English is improving, but also you're building your medical knowledge. Now, a lot of you may already have a degree in your country, and so maybe some of the knowledge you already know, but you're hearing it in English. And that should help your English as well, because as you're probably aware, part of your job is not only having the knowledge but being able to communicate it to patients. So if you're hearing it in English, it should help you with that. So that's listening and reading. Now speaking, for IELTS, it's a bit like an interview. It's like a general interview, many different topics. It could be on anything. You often need to be very outgoing when you do the speaking. You need to give long answers, and you can't plan the topic because it could be anything, and it's not really suited to the medical profession. However, for OET, you get a role play. Now you get a role play where the person who is the examiner plays the role of the patient, and yourself, you play the role of your profession. So if you're a dentist, you get a dentist role play. If you're a nurse, you get a nurse role play, and so on. Now, this is a lot more suitable for medical students because it's on medical topics. Also, it tests a lot of skills that you should be more familiar with. So for IELTS, you need to be quite active and almost aggressive in the way you speak, so you need to dominate the conversation a bit. But for medical people, you need to be receptive as well. You need to listen to the patient, listening skills, you need to have empathy, understand their emotions, you need to be able to calm down stressed patients, explain treatments. There are a lot of skills that would be very important for the medical profession. So that's for speaking. Now as for writing, for IELTS you need to do an essay. It's an academic essay. And you need to explain things like graphs and tables. You need topic sentences, you need thesis statements, arguments. You need to have to structure an essay using Western type structures which aren't really familiar to people from other countries. And it's a lot of skills that really aren't needed at all for medical people. I don't think doctors or nurses ever need to write academic research papers. However, for OET, you do a referral letter. So for a referral letter, you have a patient who's in your clinic or your hospital, and you might need to refer them to another patient, so you write up a letter. So a lot of the things like having to construct an academic essay on a topic that's not familiar to you, or the thesis statements and all this kind of thing, it's not something you need to use at all. For a referral letter, it's a lot of things that would be quite familiar to you, and it's something that you would do in your job. So OET, it's on things that you will do in your workplace. That's why OET was created. The reason why OET exists is because the government of Australia believed that IELTS wasn't useful for medical students. It felt it wasn't sufficient, and they needed to create a new test. All the other professions, skilled professions in Australia, engineering people, science people, mathematics people, all these people only have IELTS. They don't have any other choice, it's IELTS only. Medical people are the only people that have their own test. It's been made for medical people, and the reason why it exists is because it's better. It's better because it uses topics that are familiar to you, so you have, so it should be a bit easier for you to study, and it tests skills you need in the workplace, and when you study for it, you might pick up some new skills. So maybe there are a few cultural differences in the workplace in Australia compared to other countries. The way that patients might act, the role of the medical person in a particular workforce. By studying these things, you also pick up on that as well. So there was a recent study done by the Australian government, and there was two things that they tested. They tested between IELTS and OET, which is easier to pass and which is more useful. Now, in terms of how easy it is to pass, they actually said that it was very similar between IELTS and OET. It worked out to be exactly the same. However, they also looked at the people after they passed and how they did in their job and their level of satisfaction with the test. And they actually found that OET was significantly better. The students who studied for OET, they felt they picked up skills that helped them in the workforce, and they felt better prepared. So a lot of students who, maybe a lot of you are in this position, you're thinking, well, I want to work in Australia, but I need to pass a test first. And the test is very important, so you might be trying to choose a test. Now, in terms of passing the test, it is kind of similar, but you need to think beyond the test. So students, I often ask students, why are you taking the test? And most students will answer to pass. But then that's not really the right answer. The answer why you're taking the test is because you want to work in Australia. So if you want to work in Australia, OET is clearly the better option. So if you study at Melbourne Language Centre, we have several different medical people in the class from different backgrounds. You've got skilled teachers and you have good resources and materials we've created for quite a while, and you'll be able to study on medical topics, boost your medical knowledge. Because the test has more familiar topics to you, you should be able to get to the right level a lot quicker as well. So this is why I suggest OET.